Hello and welcome. We put this guide together just for you to walk you through your upcoming procedure with Professor Dr. Ahmed Nofal. Our goal here is simple. We want you to feel completely informed, really confident, and honestly ready for what's next. This is a huge step toward improving your quality of life, and we want you to be comfortable every step of the way. So let's get started. We've broken everything down into 5 main parts. First up, we'll introduce you to your surgeon. Then, we'll get into exactly what's going on inside your nose. After that, we'll talk about the procedure itself. Then, we'll map out your recovery. And finally, we'll cover the really important post-op care that'll help you get the best result. Okay, so let's begin with what's most important, right? Knowing that you are in incredibly good hands. Seriously, your confidence in your surgeon is the absolute foundation for a great outcome. Your surgery is going to be performed by Professor Dr. Ahmed Nofal. And as you can see, his expertise is just extensive. He's not only an ENT consultant and a professor, but he's also the head of the department at Reem Hospital right here in Abu Dhabi. His credentials, like his fellowship with the Royal College of Surgeons and all his work with top medical journals, it all just confirms that he's a true leader in his field, recognized all over the world. And this number, wow, this really puts it all into perspective, doesn't it? Over 4,000 advanced surgical procedures in his 23-year career. That's not just a number on a screen. That represents thousands of people who are breathing easier today because of his skill. You are in exceptionally experienced hands. So now that you know you're in great hands, let's talk about why you're having this procedure. We're going to break down the 2 things that are working together to make it so hard for you to breathe properly. Okay, so issue number 1 is a deviated septum. The easiest way to think about it is, imagine the septum is the wall that runs down the middle of your nose, separating the 2 sides. Well, in your case, that wall is bent or deviated, and that bend is creating a physical roadblock, literally narrowing the path for air to get through. And then there's issue number 2, which kind of teams up with the first one. Inside your nose, you have these things called turbinates. They're like your body's natural air filters. The problem is, yours have gotten swollen and enlarged, so it's a double whammy. The central wall is bent, and these filters are taking up way too much room, clogging up the airway even more. This slide really shows you the difference side by side. On the left, you've got a normal nose, straight wall, normal turbinates, and a nice wide open lane for air. Then on the right, well, that's what's going on with you. You can see how that deviated septum and those enlarged turbinates create the blockage you're feeling. That's why we have to address both of these things to really open things up for you. All right, so now for the good part. Let's talk about the solution. Dr. Nofal uses a very modern, minimally invasive approach. It's all about being precise, effective, and getting you back on your feet faster. The whole procedure usually takes about 40 to 60 minutes, and you'll be comfortably asleep the whole time. It really comes down to 4 simple steps. First, Dr. Nofal goes in through your nostrils with tiny cameras, no cuts on the outside. Second, that's the septoplasty, where he straightens out the bent parts of the septum. Third, he'll carefully reduce the size of those turbinates, making sure to protect the important outer lining. And finally, he'll place some soft little silicone splints inside to support everything while it heals up nicely. And this is a point that brings so much relief to everyone. Because the whole surgery is done on the inside, there are absolutely no cuts on your face or nose. No visible scarring. The way your nose looks on the outside will not change one bit. Okay, surgery's done. Now what? Understanding what to expect during recovery is so important for your peace of mind. So let's walk through the healing journey step by step so there are no surprises. For those first 24 hours, your nose is going to be completely blocked because of some packing inside. It's totally normal, and you'll just breathe through your mouth. After that packing comes out, you'll still feel pretty congested for about a week with some discharge. The most important rule here, do not blow your nose. Then comes day 8. That's the big one. That's the turning point when the splints come out, and you'll start to feel that amazing difference in your breathing. By about 6 weeks, all that internal healing is done, and you'll be feeling the full benefit of the surgery. I just want to pause on this for a second. Day 8. That's the milestone to look forward to. The moment Dr. Nofal takes out those little internal splints, it's like a switch flips. It's the real beginning of clear, easy breathing. All right, last section. Let's talk about your role in all of this, because what you do after the surgery is so important for getting a great result. We've got 4 key things for you to focus on. First, hygiene. You'll do regular saltwater washes to keep everything clean inside. Second, activity. Take it easy. No heavy lifting or tough workouts for 2 weeks. Third, nose blowing. I'm going to say it again, it's that important. Please do not blow your nose for at least 10 days. And fourth, pain. Just take the painkillers we give you as you need them to stay comfortable. Simple as that.
Now, for your safety, we need you to be on the lookout for a few things. Call us right away if you have heavy bleeding that just won't stop, a high fever over 38.5, or, and this is very rare, any changes in your vision, like swelling around your eyes or seeing double. Again, very unlikely, but it's crucial to know the signs.
And look, every surgery has some risks, right? Things like infection are always a possibility. But I want to reassure you that in the hands of an expert with the kind of experience that Dr. Nofal has, serious complications are genuinely rare. So there you have it, the whole journey from start to finish. This isn't just about fixing a medical problem. This is about getting back a fundamental part of your life, the simple, effortless act of taking a deep breath. So the only real question left is, are you ready to take that next step? Because we are absolutely ready to help you get there.